there are many ethical and legal considerations around human gene editing, and this, we have considered this for a long time, but there was really new vivid consideration from the birth of genome-edited babies, genome-edited twins in China in 2018, and there were many reactions from the scientific community and also from the media, and with some people really opposing the modification of human germline, and some being more flexible and thinking about the therapeutic aspect of that. And from this point, I think the debate come back on the front of the scene, and we had to consider again the ethical and legal issues. But this new experiment make the debate focus on human germline editing. But in fact, if you consider human gene editing, so there is also human somatic gene editing. So it means that you modify the gene of somatic cells, and then the genetic modification do not impact the offspring. And this also raises legal and ethical issues, but they are well known. It's generally around safety aspect of the product, regarding the protection of research participants and the protection of patients, and then so wide issues that are linked also to patient information, prescription, manufacturing, distribution, sale, and all these issues are mobilized the principle, ethical and legal principle of autonomy and dignity and health safety, and these are quite well known. And then when you consider human germline editing, so here the modification that you will make, the genetic modification is made either on gamete or on embryonic stem cells at a very early stage of their development. This change may affect the genome we share, so the heritable genome. And this, so that's the case following the birth of the Chinese baby. And this raises issues that are also well known from a long time, because they are linked to the question of use and access to embryonic stem cells. But we know these issues from the time we do research on embryonic stem cell, and also from the development of assisted reproduction techniques. But it raises also new issues around what should we accept and authorize regarding the modification of heritable genome, and what is humanity, and what do the future generation have rights and how to protect them. Can we do this or not at the moment for the future generation? And these are more collective issues, because we need to think not only about the patient or the research participants, but also to the future generation and to the society at large on the protection of humanity, but also it is difficult to define, and of the human species. And there are also more general issues around the question of access to these therapies if they are authorized. So they are for somatic gene editing generally, but if one day they are authorized for human germline editing, how to access these therapies regarding the question of cost, reimbursement. And this is linked to national decision, at least in Europe, because these are national decision on how to manage the national health budget. Then there are also questions, legal and ethical also, but practical issues around facilities and how to how and where to access these innovative therapies, and what will be the impact on the national healthcare systems. And of course, this is linked to the question of cost, because if you pay to access a very expensive therapy, you take part of your global budget for that. And of course, this budget is not there for something else. So these are really these are legal choices, but before they are societal choices.